guys, welcome back to Medical Coding with Blue. Today's episode is all about some mistakes to avoid as a medical coding job seeker. If you're brand new to my channel, welcome. I am Blue, I'm a medical coder. Okay guys, so I often hear from people that are saying, they'll comment on the channel and things, Blue, I don't know what I'm doing wrong. I'm looking for a job, I've been applying to jobs and I just don't know. I'm trying to make connections like on LinkedIn, I don't know if I'm doing it right. I got this message that I'm going to read today, and this message is a lot like a lot of other messages I've been getting within the last month or so. And when I get messages like these, I ignore them because I am described on LinkedIn as a YouTuber, Patreon creator, medical coding tutor, professional coach, speaker, and resume writer. All of my hats, right? All of my hats, they're all there. Not one time do you see in this list of all of the things that I do you see that I am a headhunter, that I am a recruiter, that I am a talent acquisition, that I have my own business. You don't see any of those things that I am hiring for medical coders. None at all, okay? So when I get a message that's asking me about job openings and things like that, what do I have available? I ignore this message because you clearly did not read what I'm there for, and it's very clear. So that tells me, number one, that you're not very detail oriented. That's going to take you out of the running for me immediately. The second thing that would take you immediately out of the running would be to flagrantly misspell words and not even care about grammar or punctuation or anything. So I'm going to share this message, but before I do, I want to say this. If you get your feelings hurt very easily about the things that I say, you shouldn't. First of all, you shouldn't, because of the simple fact that when I say things, it's because it is the truth. It is without any of the sugarcoating. And I think that that's what a lot of people are so used to, is the sugarcoating. Guys, this is the real world. This is real life. We do not get a dress rehearsal. This is it. When you are out there applying, no one has time for games or tomfoolery. Nobody, especially somebody in the health information industry, in medical coding, things like that. People that are hiring for these positions, they have very limited time because they have other stuff they have to do. So if you want to get into this field, then you need to sharpen yourself up as far as what you're presenting, your resume. I always talk about those resumes, guys, but a lot of you, I still see you don't take me seriously, because when I see people who watch the channel because they comment, or they're in the live chat whenever I have a premiere, and they're also on LinkedIn, and I see them crying and whining, and then they have this horrible resume, and I know they've watched my show before about that it needs to be on one page, that it needs to be right to the point, and not to complain, and they still do everything that I told them not to do. So I'm hoping that whoever watches this today, that you're going to get the message that you need, okay? Because when you are listening to this advice, I'm telling you so that you can be set up for success, so that you don't make these same mistakes that this person did, which was very blatant, just blatant mistakes. And somebody on there, when I posted this, because I said, specifically, I said, please do not do this. These messages are becoming more frequent and it's enough already. I am not a recruiter. I do not work human resources, and I am not a headhunter. If I was any of those things and a person did this to me, that's an immediate block. There is no excuse. Why? Because there's more professional ways of communicating, and not reading a person's profile to know what they are here for says a lot. My LinkedIn profile is very clear about who I am and what I'm doing here. But think about this also. You know, this person is saying that, and I'm going to get to the message here in a minute, but this person is saying that they want a job. They want a job. Can you imagine if I had other things on my mind as far as like, okay, I'm going to take advantage of this person, how easily that would be? Because this person came to me and was saying all of these things. That's why I won't entertain messages like these, because you need to pay attention to who you're speaking to. That's number one. Number two, you need to know why they're there. Because if you're so willing to give out your information, what does this say? And all the consequences that go along with it, okay? So that's why I'm telling you guys, you have to be careful. Not everybody out there is looking for your best interests, okay? But this person, within the span of 2 minutes, 8:08 to 8:09, I got 5 messages. 5 messages. And I did not respond to this person, again, because this person did not take the time to read my profile. If you don't have the time to read my profile, I don't have the time to respond to you. It would have been different if the person would have said, Blue, I'm looking for a job and I've been applying here, applying there. You know, what can I do? I would have told them you need to watch my channel, because obviously I have all of these videos on my channel talking about what jobs to look for when you're brand new. What are the alternative jobs that you can get into and things like that. Those are the types of things, that's the advice that I give. I shouldn't have to entertain somebody who's not paying attention and then have to explain to them that I am not a recruiter, I'm not a headhunter, I am not doing that. And somebody said, well, it's rude that they sent a bunch of messages, but isn't it also rude that you don't reply? No, it's not rude, because of the simple fact that they wrote to me, didn't pay attention to what I'm doing. So why do I need to sit here and explain to you what I'm doing here and you weren't paying attention the first time? Because what makes you think that when I explain it to you what I'm doing here and how I can't help you, what makes me think that this is not going to be a back and forth conversation? Because that's exactly what it's going to be, because this person wants my attention and they're not going to get it. Because the people who get my attention are the viewers from my channel, my clients, and all the other things that I have to do. So I'm not telling you guys this to be mean. Again, I'm saying it because if you are not doing what you should be doing, then why should you expect anybody else to entertain you? And that's the one thing that I won't do. But again, within 2 minutes span, 8:08 to 8:09, 5 messages. Hi, Blue. It's been great connecting with you. How have you been? Not even a chance to respond or nothing. Immediately, hello, ma'am. M-A-M. Don't do that. Don't spell ma'am, the most professional word that you can have out there, right, as M-A-M, because that's wrong. And if you use like the Word document and things like that, it'll tell you that that spelling is wrong. M-A-M is wrong. It's M-A''A''M. And then hello, ma'am, right? And then I am a, we know that's wrong, AAPC certified, capital certified, and then lowercase medical coder. I don't know what you are. Are you a CPC? Are you a CIC? Are you a CPMA? What are you? And then, is there any vacancy for medical coder? Within like a second. And then the next second, oh, can you tell me please? No, we're not doing this, because again, why aren't you looking? Why aren't you Googling for jobs? Why aren't you doing that? Why are you coming to me with this? Why are you showing me all of this incorrect, poor grammar, poor communication? Why are you showing me this? Because if I was, that's not the first impression that you want to make, okay? You need to make a good first impression that is that you understand what the whole thing is about and the seriousness of it, and to be able to talk about your skills and things like that. If you were to say that you're looking out there for a job, you have your resume down to 1 page, and in this 1 page, you have your work history that goes back no more than 10 or 15 years. It has very concise bullet points as far as like your skills and what you did. Not a whole list of a bunch of things that are saying the same thing. Not on your skills list, 50,000 things that are saying the exact same thing. You know, when I see that, when I see people's skills list and they tell me leadership, communication, teamwork, team player, all of these things, that would immediately go into the pile that I don't want this person. Why? Because you're telling me things that I don't need to know. These are all soft skills. Everybody's a team player when they're out there looking for a job. But when you're out there looking for a job as a medical coder, tell me about your hard skills. What are your hard skills? Oh, did you know ICD-10-CM, ICD-10 PCS, if you had that training, if you feel comfortable with that, CPT, HCPCS. Those are those hard skills. That's what I need to see. Because when you look at the job listings, if you're paying attention to those job listings and you see all the skills that they want, they're going to tell you they want ICD-10-CM, CPT, Higgs-PICS, ICD-10 PCS if it's for an inpatient position, medical terminology, anatomy, pathophysiology, pharma. Those are all the things that they're looking for, right? Can you use Outlook, Word, Excel, and PowerPoint? Can you use those things? That's the things that they want to know. They don't care that you know about customer service, that you can answer phones. Because if I'm hiring a medical coder, I'm not looking for somebody who can answer a phone. I'm looking for somebody who knows how to look up codes. And I don't need to know when you are talking about your skills that you have excellent ICD-10-CM. Obviously, if it's on your skills list, I know that you are pretty proficient in it because you passed a certification exam. So that's one of those things. But when I see lazy things, as far as like ICD-10 what? CM or PCS? Now, they're two different ones. ICD-10-CM is your diagnosis codes. ICD-10 PCS is your inpatient procedures. These are two different things. If you are an outpatient coder, meaning that you have the CCSP or you have the CPC, and you tell me that you can do inpatient coding, you need to be clear. Is it professional fee coding? Because that's when you have, of course, the provider goes up to the floor and they're doing their rounds and things like that. But it's inpatient, but it's outpatient. So that you need to identify as professional fee. All right. Because that's when that's going to say that you know how to do 99221 and 99222 and those kinds of things. That you know about the initial hospital inpatient, subsequent hospital inpatient, and discharge E&M for inpatients, okay? When we're talking about the professional fee side. So that's what you need to identify it as. Not that you can do inpatient. Because if I see this and I'm a hiring manager, I'm thinking, okay, this person must know ICD-10 PCS. You can never assume that the employer knows exactly what you're trying to say. Okay, so you have to be very clear about your skills. I've done many videos talking about resume tips. You can look through my videos and find those, and it'll give you all the tips that you need. But, you know, the answers are right there at the job listing too, because it's telling you exactly what they're looking for. And if you don't have those skills already incorporated onto your resume, and if you can do those things, right? If you know medical terminology and anatomy and pathophysiology and those kinds of things, if you don't have those, then obviously that needs to be on your resume, right? You know, a lot of people are blaming the industry because no one wants to hire them because they're brand new, because they have a CPCA or because they have a CCA. And this is just garbage talking. That's all it is. It's garbage. Because people who have a CCA do get hired. I had a CCA for 13 years and it never stopped me from getting a job. Never. And I had several. Okay. And people who have a CPCA, I write resumes. And I've written for both CCA and a CPCA. Obviously, this is not a guarantee, but those that have gone through my service and they have contacted me back and said, oh my gosh, Blue, I got a job. And some of them even got 2 offers at the same time, just because what I have on their resume reflects exactly what their skills and what they know. It has nothing to do with the fact that they have a CCA or a CPCA. It has everything to do with the fact that they are with this resume, they are able to identify what their skills are, and they are able to let the employer know that this is what they're capable of. That coming into this, that they're not going to need their hand held, that they're not going to need to be babied, because they can do research, they can figure things out, they can work autonomously. Because that's what stops a lot of employers from hiring brand new people, is because they want to be out there, they want to talk about needing their hand held, and they need to be trained, and they need this, and because the school didn't train them. Then that's on the school. That's not on you. That's not, not on you, but not on the employer. That's on the school. But it is on you. It's your responsibility to get with these books and to get with the workbooks and start to practice. And when you find yourself stuck and you don't understand something, then that's when you need to find a mentor who can help you for free, or you need to find a tutor. And a tutor you have to pay for, but a tutor can be worth it to help you, because sometimes you may need that, like that one-on-one coaching, and that's all you need. And it's just brief, you know. So again, there's tons of medical coding tutors out there. I am one myself. My rate and contact is in the description box below. There's a ton of them on LinkedIn. You can always get a recommendation on LinkedIn too, all right, for tutors. But something to kind of help you, to get you over that, okay, well, I didn't learn in the school and they weren't there to teach me, but, you know, I'm going to try to learn this on my own because I'm not going to give up, okay? So those are the things that you need to look at when you're communicating, and when you get an interview and you get the person's business card so that you can send them, because you can tell them, I would like to send you a thank you message after this interview. Can I have your business card? You can send them a card, you can send them an email, whichever way. But again, in that email or in that one letter, one card, right, or one email after the interview, it needs to be only one time. Do not keep following up, because there's been people who do that. And to me, if I keep getting repeated messages from somebody, that's not the person that I'm going to hire, because you obviously don't understand boundaries, and you don't understand, like, this is what we're trying to do here. We need to interview all these candidates. And if you are following back up with me and saying, thank you so much for your time, and then you kind of talk about something that circles back to that interview, something that was memorable in there, and maybe following up on a few other things, a few other details, making sure that that message is short, maybe a couple of paragraphs to 3 paragraphs at the most. And these are not long paragraphs, maybe 2 to 3 sentences a piece, but just something that's brief and to the point. You know, you have your beginning, your middle, and then your closing, and that, you know, you look forward to hearing from them, or you look forward to working with them, whatever, however you want to end it, because it's however you look forward to the opportunity, rather. You look forward to the opportunity to speak with them again, and that kind of thing. Whatever the case may be, whatever you want to close it in as, you want to make sure that it's a positive closure, and that it's going to be something that's going to keep their attention. But you only need to do this one time. You don't have to keep following up and things like that. So that's just something that you ought to know, and that means a lot. But also, again, in that message, you need to make sure that it's written properly, there's good grammar and everything else. There's a ton of things out there on the internet to help you with those messages, and make sure that you craft a good message, okay? And it's taking a little bit of time for each one of them, each place that you apply, and maybe you might have to do adjustments to your resume and things because of whatever they're asking for in that particular job listing, and you have experience with, or you have knowledge of. Those are adjustments that you do have to make, okay? And it's just part of it. And some people will complain even about having to do that, and that's just, you can't complain, guys. You haven't gotten to a point where you can complain, all right? Because complaining takes so much energy, and it takes so much time. And when you do that, you're wasting time, okay? Again, like I said, you only get one rodeo, and there's no dress rehearsal for this. There's no dress rehearsal for life. It is that when we have this challenge, what are we going to do with this challenge? If we're going to just give up just because we were applying at all these places, and maybe we need to take a step back and look at what we are sending out there when we are applying. If it's a terrible resume, we know we need to fix that resume, because that resume is your talking piece before you get there to them. If that resume looks good, you're going to have a better chance of getting in there, versus a person who doesn't care, is sending out a 3, 4, 5 page resume and then getting upset on LinkedIn and doing another cardinal rule of mine that you should never do, is complaining that, oh, no one wants to hire them. Well, with a 5-page resume, I wouldn't want to hire you either. I wouldn't, because you're not having any consideration for my time. And that's what you need to look at in terms of how are you looking at these employers. And then when I get messages of, oh, I'm so sorry, Blue, but I've been looking for a job. First of all, apologizing for something that you have not done anything to me, that already irritates me, and that's going to irritate somebody else because of this over apologetic nature that people are having. Why? That means you don't know how to use words. You don't know how to use critical words. You can say pardon me if you're trying to say excuse me, but you never say sorry. You never say, oh, I'm sorry, I'm so overwhelmed, I'm sorry, I'm this, I'm sorry, I'm this, and I'm sorry for that. No, because that just weakens your energy when you apologize, and there's no reason to apologize. You have to be out there and you have to be strong, because there's a lot of people out there that are going to take advantage, or they're going to ignore you if you don't start expressing yourself well. There's a lot of people who do actually work with people who are looking for jobs and things like that on how to improve their communication skills. There's a ton of them on YouTube. There's a ton of them on Instagram. Okay, y'all know I don't do that TikTok, so don't even ask me about TikTok. But Instagram and YouTube, they're really good for those influencers and creators that talk about things that you can do in a job interview to help you to become more confident when you're speaking and things like that. And that's one of those things, not apologizing. All right, you got to stop doing that, because it doesn't make you look demure, it doesn't make you look cute, it just makes you look like you don't know what you're doing. And that's not the time to do that right now. Because you have a trained skill. You have a trained skill. You are smart. You are capable. You are able to do these things. But if you're diminishing yourself, other people are not going to notice you. Other people are not going to see your potential. Okay? So, and then the other thing to close this one out is when I see people that says, oh, does anybody know of anybody hiring? I'm a brand new medical coder, and I'm looking at, I don't see any recruiters that will help me. Does anybody know a recruiter who will help me? Stop looking for recruiters to help you. I have said this on a bunch of other videos as well. When it comes to recruiters, headhunters, talent acquisition, these are all people who have a specific goal from the employer. They have a list of criteria that they need to find these people that this employer wants. And this employer has a very specific set of things that they want. If that headhunter, a talent acquisition, recruiter, if they don't meet any of those requirements, guess what? They're not getting paid. So they're not going to waste time with you. They're not going to waste time with somebody who's brand new. So that's why, I have said, you have to go directly to the hospitals that you want to work at, their website, look under careers and things like that. Go, if you're a member of AHIMA, you can go to the AHIMA job board. They always have job postings there. If you are on AAPC, I'm sure AAPC has a job board on their for their members as well. So that's where you want to go and focus your time. Stop wasting your time with these headhunters, because they will not help you. Recruiters, headhunters, talent acquisition, that's for people who have had experience and now they want to move around and see what else is out there. And so they're going to go basically to the highest paying position or whatever. But how are they going to do that with the help of a talent acquisition or somebody who's going to try to recruit them for that organization? Okay. Again, if you're brand new, you need to go the old-fashioned way. You need to be applying with these hospitals that you want to work at. Look under jobs other than medical coding. Anything having or relating to health information, medical records, and things like that. And when you start looking at the job listings, you'll be able to see that, okay, this position is for coding, this position is for this, or this position is for that. I have videos on my channel about alternative positions for brand new medical coders to help you get experience in using your coding skill. So, those are some of the things that you should be watchful for, some of those things to avoid as far as making those posts on LinkedIn. And then other ones saying that they can't find a job. Somebody was saying, well, I don't know why it's so hard to find a job in the U.S. And I have all of my certifications, and I'm looking at what they have on their LinkedIn profile. It's not good. It's not good. And so when you have something like that, and then that's what you're saying, and then you're complaining to on a platform that's full of your future coworkers, like they're not going to know who you are. Because trust me, you'll start to get a reputation for your behavior and how you act. You know, I had one that was messaging me, kept messaging me, and even though I said, like, on the channel and things like that, and she would watch the channel and she'd comment and things, and then there was a post that I had made about people were asking me for my rates and things like that, and I had already posted it, and I said, if you keep doing this, you know, I'm not communicating with you. And she immediately jumps back on and she says, oh no, I told you I was interested. I wasn't even talking about her, and it had nothing to do with our conversation at all. And I told her this, I'm not talking about you, you know. And she would send me messages and retract the message. So I don't know if she was trying to change what she was trying to say or what, but there would be no other message afterward. And so then I said, okay, fine, you know, I let it go, whatever, you know, no big deal. But she kept doing it. So finally I blocked her, because now I'm getting alerts that I have a message, and I look and she's retracting this message, or she's sending a message and we've already talked about this, or she watched the show and she was there and she still didn't get it. I don't understand that, but what? But that's my episode for today, guys. So just be aware and use polite manners when you are communicating with people, because when you are communicating with people and they are very busy professionals, you need to take that into consideration. Get right to the point. The more concise you are, the better off that you'll be. Okay, the more that people will take you seriously, because you're showing respect for their time. Okay, so that's just my advice anyway. But with that said, I'm gonna wrap this one up. Thank you guys so much for joining me. If this video helped you, please like, subscribe, and share, and I'll see y'all next time. Bye.